Good morning, doctors. My name is Dr. Cristina Barahona. I'm going to talk about diabetes mellitus. Diabetes mellitus, or simple diabetes, is a group of metabolic disease in which a person has high blood sugar either because the pancreas does not produce enough insulin or because cells do not respond to the insulin that is produced. This high blood sugar produces the classical symptoms of polyuria, polydipsia, and polyphagia.
Diabetes is a disease in which the body does not produce or properly use insulin. Insulin is a hormone that is needed to convert sugar, starches, and other food into energy needed for daily life. The nervous system is a network of specialized cells that communicate information about an organism's surroundings and itself. It processes this information and causes reactions in other parts of the body. Many people with diabetes eventually develop some form of nerve damage, a condition known as diabetic neuropathy. Peripheral neuropathy is the most common form and affects the extremities. High blood sugar can injure nerve fibers throughout your body, but nerves in your legs and feet are damaged most often. Let's take a closer look inside to see a major cause of diabetic neuropathy. When blood glucose levels become too high, it can cause the vessels to constrict and reduces the supply of oxygen to the nerves. When nerve systems are deprived of oxygen, it causes the axons to sever ties with surrounding nerves, and communication signals are lost. Modern approaches to diabetes management include blood glucose level monitoring, insulin therapy, diet and exercise assessment, smoking cessation, blood pressure monitoring, prescription medications, and vitamin supplements.
When food is ingested, it travels along the digestive tract, where it is broken down into its component nutrients in order to be absorbed into the bloodstream. One such nutrient is glucose, a simple sugar. Glucose gets absorbed by the stomach and intestines and then enters the bloodstream. It travels through the circulation to all body cells. Once absorbed into the bloodstream, glucose circulates, causing the blood sugar level to rise. An increased level of blood sugar sends a signal to the pancreatic beta cells, which respond by secreting the hormone insulin into the circulation. Insulin is necessary for glucose to reach and be used by several important target tissues throughout the body. These include the liver, muscle, and adipose tissue. Insulin is necessary to keep blood glucose levels stable in the body. Glucose enters the cell through a process called facilitated diffusion.
There are three main types of diabetes mellitus. Type 1A results from the body failures to produce insulin and presently requires the person to inject insulin or wear an insulin pump. This form was previously referred to as an insulin-dependent diabetes mellitus or juvenile diabetes. Type 1 diabetes mellitus is characterized by loss of the insulin-producing beta cells of the slots of Langerhans in the pancreas, leading to insulin deficiency.
The pancreas, located behind the stomach, is involved in the body's ability to use glucose. Within the pancreas, tiny structures called islets of Langerhans secrete hormones into the blood. These islets are composed of several cell types. One cell type, beta cells, release insulin after every meal. Insulin, along with glucose, passes into the bloodstream and travels throughout the entire body. Insulin binds to specific receptors located on cells. The binding prompts the opening of glucose gates, allowing glucose to enter the cell. Diabetes is a disease in which the body has trouble using glucose. In type 1 diabetes, the beta cells are no longer able to produce insulin. In type 2 diabetes, insulin is produced and binds with the cell's receptors. However, when insulin binds with the receptor, the glucose gates fail to open, preventing the entry of glucose into the cell.
This type can be further classified as immunomediated or idiopathic. There is no known preventive measure against type 1 diabetes. Most affected people are otherwise healthy and of healthy weight when onset occurs. Type 2 diabetes mellitus results from insulin resistance, a condition in which cells fail to use insulin properly, sometimes combined with an absolute insulin deficiency. This form was previously referred to as non-insulin-dependent diabetes mellitus or adult-onset diabetes.
Diabetes type 2 is the most common form of diabetes. Although it can occur at any age, it is more common in people who are overweight, sedentary, and over middle age. Glucose is the main source of energy for body cells. When blood sugar levels rise, as is normal after a meal, the pancreas gland, located behind the stomach, secretes the hormone insulin. Insulin enters and circulates in the blood and acts on the insulin receptors present in muscle, fat cells, and other tissues of the body. Binding of insulin to these receptors causes the glucose transporters to come to the cell surface. This facilitates the entry of glucose into these cells. In diabetes type 2, the production of insulin is low, and sometimes there may be resistance to insulin. The circulating insulin fails to facilitate the absorption of glucose into the cells and to keep the blood glucose level at optimum levels. This results in the rise of blood glucose levels. The excess in blood glucose reacts with proteins in tissues to form what are known as advanced glycation end products, or AGEs. AGEs create an inflammatory condition in the vasculature, which causes heart disease and damage to other organs, such as the kidneys. Diabetes can eventually cause damage to the heart, arteries, kidneys, nerves, eyes, and skin.
Type 2 diabetes mellitus is characterized by insulin resistance, which may be combined with relative reduced insulin secretion. The third main form is gestational diabetes, which occurs when pregnant women without a previous diagnosis of diabetes develop a high blood glucose level. It may precede development of type 2 diabetes mellitus. Gestational diabetes usually resolves after delivery. Gestational diabetes mellitus resembles type 2 diabetes in several respects, involving a combination of relative inadequate insulin secretion and responsiveness. It occurs in about 2 and 5% of all pregnancies, and it may improve or disappear after delivery. Though it may be transient, untreated gestational diabetes can damage to the health of the fetus or mother. Risks to the baby include macrosomia, congenital cardiac and central nervous system anomalies, and skeletal muscle malformations. Increased fetal insulin may inhibit fetal surplus production and cause respiratory distress syndrome. Hyperbilirubinemia may result from the red blood cells destruction. In several cases, perinatal death may occur, most commonly as a result of poor placenta perfusion due to vascular impairment. Labor induction may be indicated with decreased placenta function.
Let's start with some background. Gestational diabetes is a temporary type of diabetes and is one of the most common health problems for pregnant women. Glucose intolerance is an early stage of the condition.
Gestational diabetes is not your fault. It's caused by the way the hormones in pregnancy affect you. It occurs in about 5 to 7% of all pregnancies, so you're not alone.
During pregnancy, an organ called the placenta develops in the uterus. The placenta connects the mother and baby and makes sure the baby has enough food and water. The placenta also makes several hormones. Some of these hormones make it hard for insulin to do its job controlling blood sugar, also known as blood glucose. Insulin opens your cells so that glucose can get in. During your pregnancy, your body has to make about 3 times its normal amount of insulin. Gestational diabetes develops when the organ that makes insulin, the pancreas, can't make enough insulin for pregnancy. Without enough insulin, your blood sugar can't leave the blood and be changed to energy. This causes extra sugar to build up in the blood.
Most women with gestational diabetes will have a healthy baby. If you keep your blood sugars in a safe range, the chances of you or your baby having problems are the same as if you didn't have gestational diabetes.
But if left untreated, gestational diabetes can cause health problems for you and your baby. That's why it's so important to work with your healthcare providers to keep your blood sugar within a safe range. One important way to do this is by following a healthy meal plan.